And now, welcome to Healthy Veins, Healthy Legs, the radio program that gives you a leg up on how to identify and get help for ailments of the leg that can not only be cosmetically bothersome, but can actually be a big threat to your overall health and well-being. Now, here's your host, Mike Buck, and Hawaii's premier vein specialist and vascular surgeon, Dr. Robert Kistner.
Yep, welcome one and all. Just like they say, the doctor is in. And we're glad to have you with us. This program is, we present you a program called Healthy Veins, Healthy Legs, and it simply means that by taking a look at varicose veins and venal disease, you have a better quality of life. And there's all kinds of different things you can do. And Dr. Kistner has been practicing, been doing his practice for many decades and has seen vast improvements in the diagnosis and treatments. And every week we talk story about veins. And today we're going to sort of go back to Veins 101. And I really look forward to this because Dr. Kistner said, you know, what we're going to do today is talk about varicose veins. And right off the bat, I said, gee, haven't we been doing that for months? That's kind of what we do here on the program. But, you know, there are veins and there are veins. And the interesting thing about this is that if you are in a profession that sees the same old thing every day, it can be kind of boring. But we went way past that with Dr. Kistner a long time ago because every single leg, and you have two of them, and one leg can be different from the other, but every different leg tells a story. Like the old show on Dragnet, Doc, when they used to say, Dragnet. Welcome to New York, the city with 8 million legs. Well, I mean, here we are in Hawaii. There's 1.25 million people of us, and that means 2.5 million legs that we're looking at here, and they're all a little bit different. So let's start with, varicose veins 101. What are varicose veins?
Okay, Mike. Well, absolutely. You talked about the 8 million legs that walk around New York. Just think a third of those, if they're all adults, a third of those are going to have something wrong with their veins. So it is it's everywhere. It's ubiquitous. It's wherever you are, there's something there.
In other words, it's an equal opportunity affliction.
Yeah. So almost
nobody. How lucky do you feel?
If you don't have them, you know somebody that has them.
Exactly.
Right.
And then we've also learned in the past, and you can explain this as we go along, that some of this may be preventable, but in all probability, some of it's hereditary and some of it is just age-related. So it's not as though you're going to give somebody a list of, here's 3 things you can do to avoid varicose veins.
Well, so many people walk in and say, well, what is this, Doc? What does it mean? Is this a varicose vein or is... some of them are blemishes. Most people really can't tell the difference between a little blemish on the skin and the first varicose vein. And a lot of young people never had anything wrong with them, and they see this little bubble on their leg, and that's their introduction to what life is about.
And by the way, we've had a lot of discussions about this on the program before, and some of it is strictly... totally minor, nothing to worry about. Certainly nothing to call the emergency ward about. And we're going to talk about that and some other things. But I guess maybe, and this is what so many people have asked me that have heard our program that I see socially, and they say, what you guys do, what you and Dr. Kistner do is really fascinating. But and so I've got them. But, could I have avoided this? And what in the heck causes them? What caused?
Yeah, why'd they get them?
Yeah, how come?
Right. Well, so we don't know. But, maybe it's
in
who
short,
your mom
we
and...
don't know.
Yeah, you didn't choose your mom and dad, right? Well, we don't know that. And then you can't blame it on that guy because maybe it's somebody else. And maybe it's genetic and maybe it's not. We don't know for sure. But it sure does follow in certain families. And particularly if both the mom and the dad have varicose veins, the likelihood of the children having them is apparently increased.
One of the things that we've talked about a lot, and we'll begin the actual different sorts of things today with this, and these are these little spider veins that you see, these little like cobwebs on your legs, and I know that people got to be curious about this because I was, and untreated, did they ever go away, or once they come, they're there?
Yeah, I don't think they go away. Some people tell me that they had some that went away, but basically, I think they don't go away, but they don't necessarily go on to something worse. Not necessarily.
Yeah, so in other words, they can be a little thing from a trauma or from whatever the causes them.
That's another question.
Yeah.
Can trauma cause them? And I think it can.
Yeah, well, I think I had one. I mean, one of the things, gang, that I learned when Dr. Kistner I'm a patient, not just the host of the show. That I had one that I believe started out with a blow to my thigh, playing football in high school. I think it was, and I think, I don't know, is it possible to rupture a vein and then just have it stay ruptured?
Well, it's absolutely sure. We rupture veins all the time, and sometimes they rupture spontaneously from blood flow or thin walls. And that causes a little bruise. But no, the vein doesn't stay ruptured; it heals.
Okay.
So it causes a little local bleeding and maybe a sharp pain, and then you see a bruise, and then it goes away.
Okay. So anyway, this thing turned out to be almost as big as a small hand, going out, radiating out from a central point. But then after years went by, it didn't look like it was from a central point. It just looked like that whole area or that whole part of my leg had little spider veins that somehow happened.
And they do develop. We know that what you have today is not what you have tomorrow.
But so you can't. So in other words, I think of this. So that you can't go down to the drugstore and get some cream and rub it on them and they're going to go away.
No, but they sell a lot of cream for.
Oh, I bet you they do. You can cover them up, but you can't make them go away.
No, good wishes don't get rid of it.
Well, everybody, we're in this age where we talk about preventative maintenance and early detection and all of that kind of stuff. Does it ever come up that people ask you, and if so, is there an answer? Are there things that can be done, with diet or with exercise to either help them or make them go away or heal them?
There is nothing I know of that does that, and there are a lot of claims, and different ethnicities will. Chinese will have a pill for it, or
some
an
herbs,
herb to take.
Yeah.
But I don't think there's any scientific evidence to back it up.
Yep.
And it's a structural thing, so you'd have to change the structure to change it.
But what I love about this is what I've learned, friends, over the months that we've been doing this show. It's not a black and white deal like a set of building plans with rebar in every third brick. It's amazing because this stuff chops and changes and moves around and does all kinds of stuff. So there's light at the end of the tunnel about that. Then I know another thing that comes up a lot. And there's a difference between maybe a vein that you look at on your leg that doesn't look so nice, and there may be one that's sticking out like a bubble. But are there some that can get to a point where they hurt you, where they make you feel uncomfortable, where they're sore?
I just had a young lady in my office today, a nurse, and she points to these little things on the surface, and she said they hurt.
Okay,
so they do.
Now, you had to redefine hurt for me and pain for me. One is if something hurts when you touch it, or when something just hurts when you're walking around and something just starts being painful.
Okay, good distinction. So pain occurs. It occurs. It doesn't matter whether maybe you hurt, or maybe you touched it, maybe you didn't. Tenderness means you touched it. Something had to happen to it, so you perceived a discomfort. So what she was talking about was both. She said that when she's on her legs for a long period of time, the place becomes uncomfortable. She described it as fatigue, heaviness. It's often described fatigue, heaviness, tiredness, and that sort of thing. And then they can point to the veins sometimes. Other times they have these little veins and they have this aching and tiredness, and a person will put on a pair of stockings and they feel better. So the support helps them. That's different, though, than tenderness. And so some people say perceive discomfort if you touch it. So they'll say, I'm lying in bed and my husband's leg touches my leg and it hurts.
Sure.
And then they point to a certain spot.
Yeah, but when they say it hurts, don't they really mean it's sore when they touch it?
Yeah.
I guess I've redefined when I say something hurts or when something's sore. When something hurts, you haven't done anything to aggravate it. It just hurts. You're sitting there and you're in pain. Rather than when you touch something. Sometimes maybe, I guess if you get a really bad bruise, if you don't touch it, it's okay. The minute like when you stub your toe, what's going to happen when you stub your toe? You're going to stub it again. It's just human nature, right? Right. So is that the difference between hurt and sore?
Between pain and tenderness.
Yeah, there you go. Pain and tenderness.
Pain and tenderness, yeah. Okay. So this lady, she could point to it. She'd say, right there, it hurts. So I'd touch it, and she'd say, well, it's a little tender. But that's where she perceived discomfort. Now, the majority of them are not that way. most people, you touch them, and I don't know what yours was like, but probably you could bang it all over.
Yeah, you know what? I don't think that I ever got any hurt or any pain. I just noticed them.
And that's the norm.
Yeah.
But I do believe, because people come in and they call it pain, so I call it phlebidynia, which would be a Greek word for it hurts.
Yeah, and we'll talk about that some more too when we talk about swelling and the pain associated with having a swollen leg and everything. But as we move along here, right now we've really looked at these either spider veins, these little cosmetic looking things, or these bubbles. And the next question, obviously, that comes to mind, why should you treat them? I mean, cosmetically, maybe ladies more than men, I think, want to get their varicose vein spider legs treated or make them to go away. But what about the next step, say the bubbles? Why should they get treated?
Well, let's go where you were. Take the spider vein.
Yeah.
So it is cosmetic. I mean, it's a blemish. It's not what's supposed to be there wherever it is. If it hurts, well, then there's a reason to treat it. If it's just cosmetic, that's a reason to treat it. The other question is, well, does that lead to further disease? And does that spread and become a worse problem?
Yeah, and I guess that would be my major concern. It was my major concern.
Okay.
That's why we ended up doing what we did to me.
And sure, and so if I have a spider vein today and a varicose vein tomorrow and a venous ulcer the next day, well, we don't have that connection. So we know that you have many, 60% of the population probably has spider veins. So to be a normal person, you probably need a spider vein.
Could you skip right by spider veins and go directly to a varicose vein or to an ulcer? No spider veins.
Sure.
Yeah.
Sure. No, spider veins
They're not connected.
Probably do not actually progress themselves. But remember, the venous system is a collection system, so all parts of the venous system are connected somehow to some subtle extent. But we don't see the spider veins necessarily progressing to varicose veins.
Okay.
So if you have the spider veins, you're probably normal. Don't worry about it. And if it drives you, if it makes you uncomfortable or changes what you wear or changes what you do, you can have those treated, and it's a cosmetic treatment by injection or laser.
I was going to ask you about that because I was talking to somebody that heard one of our programs, and that you were doing a treatment of me of a peripheral vein, which we'll talk about later. You were treating a problem, and at the same time, since I was in there, it's like when you get a car up on a rack in the gas station to change the oil, and there's a hole in the exhaust pipe, you fix it up, right?
That's right.
So is there, say, when somebody says, okay, I've got a bunch of these things and I want these cosmetic spider veins and I want them treated, is there strength in numbers? Are they like $6 a piece? Or how do you figure out, when you're going to have this done, how much you can have done at one time? Can you do a lot at one time? And does it make sense to narrow down the number of visits and do as much treatment as you can all at once?
Well, it probably depends on the practitioner. My thought about that is it makes more sense to treat them from stem to stern, from all the way from the groin to the ankle, or into the foot even, at one time. You can treat a whole bunch of them. It just takes time.
Yeah.
A bunch of annoying little needle pokes. Inject a medication that really doesn't particularly hurt. We do it without. You don't need an anesthetic for it. You
I
just
know.
do the
I
deal.
can attest to that. But, we might have to redefine. You say little hurt, and I say yikes.
No,
but,
wait a minute. Hey, wait a minute, Mike.
To tell the truth, I think what's happened, and you explained this to me, that like a lot of other techniques, it's come such a long way because the instruments that you use today are so much smaller, and it's so much easier to get into and treat one of these veins or inject something than it used to be. And I mean, just technology has done this.
Now, we hear that women are pretty tough, and they tell us how tough they are and
but
what
us
wimps men
guys,
are.
we're wimps.
Okay,
Yeah,
we have ladies come in with these things up and down their legs, and they'll literally lie there for an hour or longer.
Yep.
And you're poking constantly, a little needle all the time. And at the end of that time, they'll sit up and say, hey, you missed this one over here or that one.
For heaven's sakes.
And
Really,
so, I mean, these are really, they're really tough
I'm like
people.
that. If I'm going to do this, I want to get my money's worth. I want you to do them all. But
That's right.
but isn't that true? I mean, they say that if you have a plumber or a handyman come to your house to do a job, the more you can get them to do, the less each one costs. And I know that is a concern because you've mentioned this before, Dr. Kistner, that these spider veins, these little blemishes, if you will, it's elective. I mean, this is not something that the insurance companies think is something they ought to cover. You got to pay for that yourself.
That's right. And so it doesn't have a standard charge, and so people may charge by the hour. We charge by the time that we
sure.
spend doing it and the materials we use. Some people will charge by the number of injections they make.
Gotcha.
Some people will only treat a certain area of them, and just to limit the phrase, because the intensity of it. Because when you're treating them, you really have to concentrate, and it's pretty intense to get in those little tiny veins. So there's a matter of fatigue if you keep on treating them up and down the leg. So a lot of different reasons, but each practitioner will have his or her approach, and they'll tell you what it is when you go to see them.
Okay, so that's
now you can also treat them with a laser, Mike. So
laser being, instead of a fluid that you inject, you just put the laser in there. It's heat.
It's a beam, and the beam actually creates heat at the point of focus where it's focused into the tissue, and that's so hot that it'll make the blood boil. And when the blood boils, it injures the inside of the vein, and then that causes the reaction that heals the problem.
Isn't it amazing the applications they found to use for that technology?
Well, it's incredible.
Yeah.
Now the laser that we use on the skin is different. I mean, the same principle, but it's a different presentation. We can use it inside the vein in a kind of a wire module, and we can run that up and down inside the vein and treat the bigger veins inside your leg with that.
Now, when somebody says, I've got, spider vein, which is what we're still talking about here, you can see by its size how big it is. But what I learned from you off the air, and I'm amazed, that some of the larger veins inside your leg are pretty big. They're like hoses. I mean, there's a fair bit of blood going through that vein.
Well, there's as much blood going through the vein as goes through the artery.
Yeah.
So what goes out the artery comes
Got to
back
come back up through the vein.
So,
sure. Okay. Now, but let's go back to these things. When we talked about treatment, how do I know that that say that they need to be treated? I mean, outside of a cosmetic thing, is this something that you're going to diagnose me at and then just say, okay, this is what I recommend for this and this is what I recommend for that?
Well, that's where I think we ought to go today, because we're talking about the things that occur to the majority of people, and they start off as simple problems, and maybe not even a problem, just a cosmetic thing. So if it happens to be under your arm and you never take your shirt off, well, you don't care about it.
Who cares?
Yeah, right. But, that's not really true, because people care because it's their own image of themselves. And so we often ask people, well, how do you want us to treat the back of your leg? And, men, they never look at the back.
I don't know. What's back there? I don't know.
Well, you ask the ladies, and you ever see a lady stand and look at the back of her leg?
Yeah.
That's right.
There, yeah.
And so they know what's back there. So, but it is not so much treating, people are not treating them so much for the observer of their leg. They're treating them for themselves and how they feel about their presentation. So it's just like how you paint your face, I guess.
Okay, now that means, so that's a decision that you make and that you do in corroboration with your doctor. You talk over, and they're inquisitive about it, and you outline the course of treatment, and then the patient makes the decision if they want to go forward with it.
Yeah, and the indication to treat these is just about always cosmetic.
Yeah.
Occasionally somebody says, well, they hurt. Well, maybe that's a partial indication, but insurance doesn't recognize it.
What about if you don't treat them? What's going to happen to these spider veins or these things that you say they present themselves that you can see them? Will they get worse? Can they cause a problem later?
To my knowledge, they stay there, and I don't think they cause a problem later. There's, except for one instance, and this is an important one. If they're very, very thin-walled veins and they exist on the ankles or the feet or maybe the lower leg, they can rupture spontaneously, and that does catch a person's attention.
Yeah, we've actually talked about that on the program before, and it is sometimes maybe somebody thinks they need a trip to the emergency room because all of a sudden, for no reason, they just start bleeding.
Right. So as you say, as the next phase, you have spider veins, you're not particularly worried about them. Maybe don't even know you have them, and you're taking a hot shower one day, and all of a sudden you see a stream of blood and hit the side of the shower stall, and that is panic time. I mean, people really panic with that, and for good reason. I mean, their blood is going out and hitting the wall, but they stand there and look at it.
And this blood is coming out without an invitation. You didn't damage it. You didn't poke it, spindle it.
Yeah, and it doesn't hurt.
No, and it doesn't hurt. It's just bleeding.
But, there's some good news about it. You think, well, wonder if that happened in my sleep. Well, when you're in your sleep, you're not standing up, and so you don't have a head of pressure. It rarely, if ever, ever happens lying down. So it's not something to worry about in that sense. But
I know that we've talked about this before, but I think that because we always have a new audience. So it's bleeding. Will it stop? I mean, why do people panic? Because it just keeps bleeding. And I would imagine the more they do to try to stop it, maybe it's just not stopping. They get panicky about it.
I have two sayings about bleeding. One is it always stops, but of course you might be dead.
Yeah.
Okay.
Yeah, once you don't have any more blood, it stops.
But on its way, it probably causes you to lose consciousness. You fall down, and then veins don't bleed any longer when there's no head of pressure. So the head of pressure comes from standing up.
Yeah. So the reason why I said that is because several programs ago, there was a story in the news that we happened to discuss on one of these programs. And that was a guy that had a vein that was bleeding so badly that he collapsed. And when he collapsed, somebody called the police because they thought the guy had been shot. This is a tourist in Waikiki.
That's right.
He had that much blood, So there would be reason to be concerned because one would think if you just kept standing on it and you kept running or you started to run to try to find a doctor, it's just going to bleed and bleed and bleed until you will pass out.
Okay, but now there's another good thing about bleeding because it's a sign of life. Because if you're dead, you don't bleed.
Yeah, there's
all right. So the tissue it doesn't mean you, but the organism, but means that the tissue that's bleeding has life in it, and so if you get dead tissue, it won't bleed any longer.
Yeah. Okay. So
so bleeding is good and bad.
Yeah. Okay. Now the other side of this is if somebody comes in to get treated, the ones that bleed, what makes them bleed? I mean, what is the reason that all of a sudden I'm in the shower and I start bleeding? How does it get out that hole in the first place?
What happens is that these little veins, you asked if there's anything that can happen to them, and I said no, and so that was wrong because the answer is like the vein that in the ankle. You have it for years. Mm-hmm. But if you watch that thing, then it may get a very, very thin wall on top. And what's actually happened is that the vein has become the surface of our outer surface, and so it has blood circulating within a couple of cells of the atmosphere. Mm-hmm. And so if something happens to that thin covering, it blows a little hole in it, and it bleeds.
Very, very, very thin.
Mm-hmm.
Yeah.
So that can it can just wear down and wear through the skin, basically. But I've seen them where they bleed, and then you expose it, and there's no skin there. There's just vein on the surface.
We're halfway into the program, and I want to congratulate you for not talking only one little time did you say stockings. And what comes to mind is there are stockings and there are stockings, and I think that obviously that we want to know will the stockings help in treating a vein or not?
The stockings will not fix the vein.
Okay.
The stockings may relieve the symptoms of a vein. So let's shall we push on into varicose veins?
Yeah. That's what we need to do. Push into the varicose veins because I am wearing a pair of these socks right now. They come up to just under my knee, and they're a struggle to get them on. But the moment you get them on properly, and I've learned how to do this, so it's like putting on any other pair of socks. A little more effort because you have to stretch them. But moments after you put them on, it gets to a point where you either have a sense of relief or a sense of comfort, and that's, I think, worth it. If nothing else happened, you're comfortable.
Right. And then, but then
they're not going to heal anything.
You cannot translate that into healing it.
Right.
So it's a Band-Aid in a way. Mike, you had varicose veins.
Right.
When did you notice your first one? How old?
Well, see that
Where was it?
I think my first varicose vein was around the inside of my knee when I was playing football in high school. I think.
That's what you first noticed?
I think so, yeah. And maybe even in college, but I think in high school.
Did it catch your attention?
Only as a curious thing. I thought, did I hurt myself? And I think I might have even poked it to see if I can drain it. I think I did that when I was a little kid. Now I know that you'd scold me if I did that again, because don't try this trick at home kind of thing.
Yeah.
And I would imagine that other people try that too. And they'd say, well, maybe I'll just poke it. Maybe if I poke a little hole in it, that blue stuff will come out and it'll go away. But it didn't.
I see.
Yeah.
Did you poke it with a big knife, or did you?
No,
poke
I think I heated up a
soldering iron.
safety pin. A safety pin.
Come on, did you really?
Yeah, and I think I heated the tip of it with everybody in those days used to smoke. I think I used a cigarette lighter or matches to heat the point of it. So I thought that was, well, if I sterilized it, I'll be all right.
Well, you're ahead of your time. That's the first heat treatment of.
Yeah. Maybe I could have invented a laser. But
That's right.
But
yeah.
I mean, I'm sure you hear anecdotally about, can I do it to myself? Can I pinch it? Can I squeeze it? Will it go away?
Well, you're the first guy I heard that ever put a hot
No,
pen in it.
I mean, I hate to admit that, but I did.
But you did.
Yeah.
Wow.
And it bled a lot. And then it stopped.
Now, what happened to that area?
Nothing.
Nothing.
I mean, next day it was still there. Except I had a little hole there, where I poked it.
Well, you're more
Well, I think
adventurous than some people.
I think guys will do that just to see what it's up. So that was my initial experience, and I never had it looked at. I mean, I never had anything looked at until way 30, 40 years later.
Okay. Yeah. Okay. So now we're back to that's the norm.
Yeah.
People have these things. Yeah. Okay, and so they become a normal way of life. So a person then at some point looks at a vein and says, well, what is this, and is it important, I guess?
Mm-hmm.
Because initially they don't hurt. So we talked about the difference between spider veins, which are in your skin, and varicose veins that are under your skin. So that is the difference.
Okay, well, what about, maybe the difference is also self-esteem or whatever, because when you're a little kid, you don't care, and if then you get more of them, and maybe you think, well, I don't like this. I'm not going to go to the beach and be around my friends until I get tan because I don't want people to see my legs.
Oh, absolutely.
Yeah,
sure.
Now you're penalizing yourself from having some fun because of the way something looks that's maybe not harmful to your health, but you just don't like the way it looks on you.
Oh, absolutely. Yeah. So that's true of the spider vein. It's also true of the first varicose vein. So we do see young people who come in and they say, well, this vein, what is this vein? I don't like it there, or maybe it hurts or something. And the question is, mm-hmm. Is it going to become something? Is it it's abnormal? Why would I have this thing? Should it be treated? And how
about what's wrong with me? What's wrong with me?
Right.
How come I got this?
Okay.
Maybe I shouldn't eat chocolate anymore or whatever.
Yeah, exactly. That sort of thing. And then the answer is, well, does it cause symptoms?
Mm-hmm.
And then, well, what are the symptoms?
Yeah, now this is the part where it gets interesting, because this is the part where if it does start causing symptoms, it goes, I think, in my opinion, and I'm sure that a lot of your patients feel the same way, it goes from being a nuisance and something that is not fun to look at to being what is perceived as a problem.
That's right. And a
health issue.
Long about that time, insurance starts to take an interest,
mm-hmm.
because that's why you have insurance, for your general health. So if it becomes somewhat of a health issue, it has that. And one of the health issues is it hurts and I can't do my normal day's work. So one of the insurance criteria is, does it interfere with your way of life in some way that you can identify? And it does. I mean, it might cause you not to stand up so long, or it might cause you to wear something, or not to go out, not to do a certain job. Who knows? But there are a lot of different things.
I actually heard from one person that said, I was listening to your program, and this actually happened to me at my workplace. It got to a point where I'd get sore and I'd have to take a break. And after a while, my supervisor got tired of me taking breaks and suggested that maybe I look for some other kind of work, because they needed somebody that could work for several hours without taking a break.
Oh, that's a really good example.
And
that can happen.
Yeah,
absolutely. So then the answer to, so what are the symptoms?
Yep.
The most frequent symptom is a sense of heaviness, Might be called fatigue. It might be called discomfort. But an awareness of the lower extremity, this is in the legs. It's not in the upper body. This doesn't happen. So it's the legs that are well down below your heart level. And it has something to do with being on your feet, or it can even happen with sitting prolonged. It doesn't happen lying down. So.
Yeah, and the reason why it doesn't happen lying down is there's no gravity pressure. Your legs aren't filling with this fluid, right, with your blood.
No, but what does happen lying down is night cramps. And strangely, night cramps are considered as one of the symptoms of vein disease.
Interesting.
And I don't understand it, frankly, but anyway, it does happen that when we treat veins in people, they often come back and say, my night cramps are gone. I mean, very, very frequently. And so even insurance will recognize night cramps as having some relationship.
Is it sometimes difficult, Dr. Kistner, to decide how to, explain to an insurance company what a patient needs as treatment? I've been doing this a long time, so obviously the answer for you is no. You diagnose somebody, you submit the paperwork and whatever insurance gets approved based on your expertise, which is respected by the insurance company. But is that sometimes an issue, trying to explain to an insurance company what's going on with somebody so they acknowledge it and agree to pay for it?
It is, and insurance companies are different. The big national insurance companies include Medicare and Medicaid. Medicaid is being state, but these are government type of programs, are pretty impersonal. So they'll have things written, and if you
criteria or something,
if you hit within those criteria or can make the case that that's the truth, then they'll pony up for it and pay the cost. But if you don't have the right wording about to comply with their requirements, then they won't cover it.
Is that difficult to stay up with? I mean, you as a physician and a surgeon, you diagnose and treat these things. This is what you do all the time. As a matter of fact, every now and again I got to call the doctor's office and I'm sorry, he's doing a procedure. Well, I got to wait because that's what you do. You're in there. So you already got a pretty good handle on it. Is every now and again, does an insurance company deny a request for somebody to get treatment?
Oh, absolutely. So they'll write back and say that they deny it and what the reason is.
Okay.
And then you go look up and see what their verbiage is and see whether the patient's story, whether you stated the case wrong or the patient stated the case wrong, and whether you can make it fit the criteria.
So you could resubmit the request to treat that leg.
You can, but it gets harder each time because they go up the ladder, and so you've missed it the first shot out. And the easiest thing is to get it right the first time.
Okay, now let's take it a step further. Let's say that I've got this condition, and that it gets diagnosed, and I've got the symptoms, and I want to get them treated, and the insurance company approves it. Once you've treated this, what happens? Do you cut them out? Do you take them out, or what's going to happen after you've taken the veins away?
You're talking about varicose veins.
Yes.
Well, let's go back a little bit. Let's go back and separate the varicose veins, because we use the term varicose vein, and that refers to a dilated vein. It has thin walls and it kind of presents as a bubble under the skin. You may or may not see it as a blue bubble, but some kind of a bubble. And then you associate a symptom, and the symptom may be heaviness or tiredness. But more specific ones are itching over that area, tingling, throbbing right in that area, associated with being on your feet.
This is all like a burglar alarm going off. In other words, your body's telling you something.
Yeah, and people will say, oh, that burns. So it's a burning sensation, but it's some sort of a sensation. So the word that really covers it is an abnormal sensation or a dysesthesia, and there's something that's abnormal about that place, and it looks like a vein. Then what we do, the first thing is have them put compression on the leg to see whether that relieves their symptoms. And this is where stockings come in. So you put on a pair of stockings, and you just come back and say, well, gee, my leg feels better.
Feels great. That's what happened to me. Feels great.
So that's a therapeutic success. However, it only works while the stocking is on. So people become very disappointed with the stockings because the vein didn't go away. Okay. Well, the stocking can't make the vein go away, but it can relieve the symptoms. So some people, and if you work in a cold climate and your legs are never exposed, you might just settle for that, and that's fine. You don't want a procedure.
What comes to mind is that I want to harken back to the what we're talking about. If somebody stands up for a living and can't because of the conditions or the symptoms that come, and from what I understand, and I know this is true for me, because when I have the stockings on, generally every day and generally all day, my legs are not a thought. I mean, I just don't give them any thought once you get used to this. So I'm guessing that in many cases, a pair of stockings worn properly will allow somebody to continue at their work or at their play unabated. They can just go ahead and do this because the stocking is giving them the kind of compression so that whatever symptoms was making them uneasy or uncomfortable won't happen.
Absolutely.
Yeah, this is good.
That's true. That's good. Now, another question comes up. Will wearing the stocking prevent the veins from developing progression and complications over time?
Yeah, I got bad news about that. I've learned that. You said no.
Yeah.
Yep.
But we get to that at another time. But they don't do that. But so anyway, we got this person, and your question was, well, what do we do about it? Is that what you said?
Yeah. Obviously, I mean, now it's to a point where you've got. You can go to work and you can enjoy without getting the symptoms, but like you said, that's just being masked by the effectiveness of the stocking doing its job to keep you compressed.
Now look, we're fairly far down the line, so we started out with a young person and they saw a little bubble on their leg.
Yep,
so let's say it happened in their teenage, and that can go on for 10 or 20 or 30 years just that way.
That's it.
So and no progression or maybe a little progression. So that's a big part of the listening population. That answers one of their questions about so what is it and do I have to rush out and do anything about it? On the other hand, what is happening underneath is, whether it's because of the presence of that particular vein or just that it affects more tissue, the walls of other veins become weak, and you see not only just the one vein, but you might see a chain of veins, and they tend to run up and down the leg. When that happens, symptoms are likely to be more severe. They might be such that you really can't tolerate your job. You can't stand at the sales counter, and some sales counters, they don't want you to sit down.
Sure.
And productivity. Lots of them, right. Well, people can't do it.
Here's my concern, because obviously the more that's happened in the leg, now you might be looking at multiple symptoms and multiple stages. In other words, some are spider veins, some are the little bubble, and some are inside my leg really causing a problem.
Right.
In other words, now I've got multiplicity of stuff to deal with.
So I think if somebody asks, well, what should I do? What should I do for myself? Is if you have some symptoms and they're affecting your life in some way, you might want to check them out. But if you have not really a concern about that and you just had them and you had them for many years, they don't bother you, and you see your doctor and you say, well, it's just a cosmetic thing or put on a stocking, go ahead and do that. If they're commanding more of your attention and they're beginning to affect your life, then you want to get a study of your veins. And the study of the veins will show maybe that's just a peripheral vein and one little thing there, and you just fix that, maybe inject it, and it goes away. Or you may have a chain of them up and down the legs, and you can't tell that by physical examination. The doctor can't.
Yeah, that's way inside. These veins, by the way, now we're not talking about these little spider veins anymore. We're talking about veins that are more towards, might be in the very middle of your leg, right by your bone. I mean, you can't see them at all.
Well, but generally they're toward the surface. If you happen to be very heavy, the tissue can surround the vein, so you can get a big vein, you don't know it. But you can still have symptoms of heaviness and tiredness. So you go to the doc they order an ultrasound exam, and so that's a scan of your veins. Then you find out, well, those valves are not working all the way up and down my leg. So I think that the phases are for small peripheral isolated veins, not of much importance at all. You don't need to treat them unless you want to. When the veins start to go all the way up and down your leg, from the groin all the way down to your ankle, and they're a continuous chain of leaky valves, those veins are the ones that probably will go on to produce more severe changes when It's not just the veins that are a problem, but the skin becomes a problem.
Yeah, now you're getting into the smaller part of the population that has this problem, but the problem's a big problem. Do a lot of people feel at this point where they start to question because they just say, "Well, doc, does this all this stuff mean is this affecting my circulation? Is this going to give me a heart attack? I mean, what's next if I got all the pain here and you're telling me I got to have these things treated? What happens if I don't treat them?"
Exactly. And the answer is most of the bad things you think about aren't going to happen. It doesn't cause strokes. It doesn't have blood clots running around. Not this what we're talking about now. It's just that they tend to progress and develop up and down your leg, and they don't go away. Mm-hmm. You can wear a stocking on top of it, but it doesn't fix it. So
yeah, which is
permanent.
It's counterintuitive. I mean, most of us want to think that, okay, if I do this, it's going to go away, right?
Right.
And I just need to hear that. But, you're telling them the truth. No, it's not. I mean, we're going to deal with it another way.
But the other side, it may not progress for 10 to 20 or 30 years.
Mm-hmm, which is good. Yeah,
that's pretty long.
Yeah, you did.
But when it does progress, you begin. It catches your attention more.
It's just like
more symptoms.
I'm just trying to think. A dear friend of mine's a dentist, and all kids ask him the same thing. If I brush my teeth, will my cavity go away so I don't have to get drilled?
Okay,
now it's a little bit too
it's
late.
Exactly the same.
Yeah. Okay, now that being said, I'm really curious about this. You talked earlier about the different kinds of treatment on a varicose little cosmetic vein. There are a couple ways you can do it. One is with the injection of the stuff. The other you talk about is the laser. What about when you start talking about the more serious treatment? Are there methods there too that maybe some would be drugs or some would be injections or some would? What are the options?
Yeah, sure. Let's go there. It's not your diet.
Mm-hmm.
There's not a pill you take to make them go away. So it's a mechanical problem. The vein wall is weak and the valves don't work. So it requires a mechanical solution.
Got to get in there, you mechanic. That's where you come in.
Now the simplest way is for the doctor to put a needle in it, just like you started to do, and then you inject something in there, and it'll make the vein dry up. So what do? What do we inject? We inject something called sclerosant, and that's an irritating solution that really causes inflammation of the inner wall of the vein. And then what happens is the inner wall kind of comes loose and the vein develops a blood clot in it.
Now, that sounds painful, is it? I mean, I'm not talking about the poke for the treatment. I mean, afterwards. Is there pain related to the treatment after the injection?
Not really.
Okay, so it just does its thing in there.
It does its thing, and it goes through a healing phase.
Mm-hmm.
So if you have, say, isolated veins or peripheral veins or even bigger veins, one can stick a needle into that, and sometimes use ultrasound to guide the needle and put it in, and then inject a medication that'll cause the wall of the vein to get injured and the vein not to function. Okay, so this is injection treatment. Now, injection treatment is probably the first intervention, simplest intervention, and it can be done to outer veins. It can be done to inner veins. We can even shut down the whole saphenous vein. That's a major vein under the skin. And sometimes you can add foam to those or just liquid. So a lot of tricks to do with injections.
Okay, and that, based on your experience, is the different patients require maybe a little trial and error to see which of these injections is going to work best for them? Are there differences between my veins in my leg and another guy veins in his leg? Well,
not really the patient. The doctor will have criteria that say, well, this is a good one to treat with injection, or this probably won't respond very well and we better interrupt the vein.
So it's possible that you're going to get diagnosed and then treated a little bit differently for different veins in the same leg. You're not going to do the same thing all the time everywhere.
It is. Yeah, you're right, depending on their connections. And another question is, well, if I have this vein treated, what will happen to my circulation?
Yeah, that's what I was deathly worried about. I said, okay, it sounds good. Take out all these veins. Now what? I don't have enough veins left.
Now, that... And so the answer is not much, because this is a collection system and the vein is not a critical part. So actually that vein that's dilated and the blood is just kind of sitting there and it's not functioning well, your circulation is probably better off without it. So removing the vein is therapeutic, and it helps the whole circulation in the sense of the health of the tissue is improved by getting rid of the veins that are not functional.
Okay, at what point do you get where it becomes a concern? Because, I mean, there are some people that I guess need minimal treatment. You know, they get one bubble in their leg and you get in there, take it out. But what about when you see these, you know, these railroad tracks going up and down somebody's leg, and there's all kinds of stuff that's got to be treated? As you start treating that and removing more and more and more, does it ever get to a point where you can't remove any more because they don't have any left, not enough left?
Well, in the surface veins, no. Mm-hmm. I mean, you can keep going because the body will keep. We have millions and millions of little vessels, and they'll find a way in the vein
side. They'll grow if they have to grow. They'll get bigger.
Yeah, but the same isn't true on the artery side. So if you begin knocking off the arteries, well, then you run out of that kills the tissue. But the veins really don't. So you can treat the veins pretty much to get rid of the problem.
In the healing process, once you come and do this. You know, because I know from my own treatment that sometimes you've made several pukas or several little in each leg, several interventions, I guess you call them. What about treatment after that? Do you have to be careful? I mean, can you get infections? What do you need to do after you've had treatment to make sure everything heals up and goes to a point where it's not letting any bad in?
Yeah, that's a good point. Well, once we treat them, the majority of them just heal up. Mm-hmm. And so,
in other words, can I go swimming in the next day or two?
Mm-hmm, mm-hmm.
Yeah,
with just an injection.
Yeah,
mm-hmm, mm-hmm. You can. What happens is that you've injured the inside of the vein wall, and so the reaction to what you did occurs inside the vein wall.
Okay. And
so that thing becomes a little bit inflamed and swollen, gets a little blood clot in it, and then that turns to fibrous tissue and heals and goes away. Becomes a scar.
Yeah. And this is, I mean, it sounds like it's several minutes, but I've learned that sometimes these treatments, when you do them, and we're in an instant gratification society. You know, you walk in there, you want to get injection, you want to walk out with a pretty leg. What you tell me, and it's true, you just have to be a little patient. It took a long time to develop. And so this injection sometimes takes a while before it gets in there and really makes the vein so you can't see it anymore.
Yeah, it really does. It takes weeks and sometimes even more than that for the healing to go on. And if we track the healing very carefully, we can see changes out to months later. Mm-hmm. So you're right.
I've actually noticed that in myself. Okay, so as we've talked about this, we've talked about the very early stages of the spidery, the little cosmetic things. And then we talk about some of the treatments that you've done. What always people know, or what they know about this, is I guess what they've heard, and this is usually over a long period of time, many years, that it used to be a very invasive, huge hospital procedure where you used to get knocked out and have your veins stripped and taken away. And I know that that's still done sometimes. And let's talk about that. You know, that maybe some rehab is a lot longer, that some surgery, some treatment is a little more invasive and it requires more monitoring maybe.
Well, it depends on, you're right, it depends on which veins you're treating, but the surface veins are a minor problem as far as treatment and recovery. There's really no downtime. That is, if you treat the surface veins, you can put a little compression wrap on your leg and go on and do your normal thing. That includes if you're standing at a counter and selling your goods, you can do that tomorrow. Mm-hmm. If you're a laborer, you can go back to your labor.
Which is, by the way, I think that's very relieving. Those of you that are out there, I certainly didn't want you to think that, you're going to go get your veins treated, you're going to be off work for a month. You're going back to work the next day. You're all right.
Yeah, and so people have legitimate concerns about that. Well, is it okay? And the fact is, it really is okay. And in fact, the more active you are after vein treatment, perhaps the better it is. It's good for you in general, and it carries your attention away. So, you talked about what we used to do and what we do now. So when I can remember 50 years ago,
Unfortunately, so can I. Yeah.
But anyway, people would have this done. They go to the hospital. They'd have the veins treated in their legs, perhaps, and what would happen? They go to the operating room, and the surgeon would make holes in their legs and run a cable up and down certain veins and pull them out. Mm-hmm. And then there's a lot of tissue damage, and so the person would lie around the hospital, and then the idea was put a big bandage on and keep them in bed. Well, so this would track out, and they might be in the hospital for 3 to 5 days and limping around for a week or 2 or 3 afterwards.
Needless to say that a lot of these people wouldn't be candidates for additional treatment after they went through something like that to say, you know what, hey, unless I'm going to blow up, I'm just not going to do this.
Yeah, and that's true. And yet the thing that was done was really good. Physiologically, it was the right thing. It got rid of the vein. So that's all been simplified now by a bunch of developments, both in technology and in diagnostics. And so the contrast is that if you have the same thing today, you can walk in and have an office procedure and go back and do your labor that afternoon.
That's such good news. Now, before we run out of time on this episode of Healthy Veins, Healthy Legs, even though you said early in the program that it's not likely to cause you a heart attack or a stroke, what if you do have these conditions and for whatever your reason, you just don't have them treated? What would be some of the dangers that would present themselves if you did have a bunch of varicose veins or a varicose vein disease that you didn't do anything for?
Right. And so it gets around to why would I want to treat my veins? 2 reasons. One really important one is that some veins in some people will progress to cause tissue damage to the tissues of the leg. Mm-hmm. And when that happens, the tissues change color and get thickened and be changed from normal tissue to scar tissue. It's an irreversible change. Once it goes to scar tissue, it can't go back to normal. And that can be progressive to the point that you begin to develop holes in your lower leg and called vein ulcers.
Yeah, I hope that very soon that we can devote a whole program to these vein ulcers, because I had one and it was scary, and I'm so glad that I got it treated, because I got really over worried about that hole, and now that I know what I had and it got treated, I feel a lot better about it.
Right, and so, but it doesn't happen to everybody. Mm-hmm. So, and everybody who crosses the street doesn't get hit by a car.
Yeah.
Okay, but if you happen to be one of the persons that's going to go on to trouble, well, there are way stations that we can see along the way.
Well, you use the analogy, but what about like guys that go out and get hit by the car, and then the next day they get hit by another car? There's some people that are just bad luck guys. So I mean, these ulcers, it certainly doesn't mean if you just get one and you get it treated and goes away that you're done. That you once you get them, you could get them forever.
Well, the other more sobering thought is that what's happened to get that first ulcer was a lot of tissue damage.
Yeah.
And when I just said that some of the tissue damage doesn't reverse, so you got sick tissue that will always be that way. It'll always be an Achilles heel, if you will. You can get sick from it.
Yeah. And I saw an ad the other night for some mouth product, a toothpaste or something else, and it was talking about once you take the enamel off your teeth, that's it. And you're not going to regrow enamel. It sounds to me like even though you think your skin's an organ, you're going to keep replacing it. Once you get that to a point in that area, there's really not much of a road back.
Yeah, it affects your life for sure. Yeah, it's a big deal. So, but that runs out. You've capsulized this as serial events, but it's separated by decades of time.
Yeah.
So there's a lot of time to get.
Yeah, but
to
see, we only have an hour in the program, so we have to make it sound like.
How are we? What are we doing?
It makes it sound like we got to say it all in a few minutes, but that is the good news. The good news is there's light at the end of the tunnel, and that's why Dr. Kistner does this program, because it's all about getting educated about this. And you must feel great when somebody comes in and says, you know what, I kind of think I know what's going on. Is this right? Is that right? And by golly, I think I want to get a treatment. That's what it's all about, isn't it?
Yeah.
Yeah.
And people really, this is one thing where you can treat people and they feel very, very much better right away, and they're really happy to have had this little thing done.
That's exactly why we named the program Healthy Veins, Healthy Legs. If your veins are healthy and your legs are healthy, your life is healthy, and that's what this is all about. So we want to thank you for being a part of the program today, and remind you that if you want to hear something on the show, or if you want to ask Dr. Kistner a question, It's simple. Go to the website and send them an email. Not all of them are going to get personally returned, but we will address the issues as time permits on this program. It's KistnerVeinClinic.com, www.KistnerVeinClinic.com. We'll see you again next week with another issue of Healthy Veins, Healthy Legs.
Thanks for listening to this edition of Healthy Veins, Healthy Legs. For more information, go to www.KistnerVeinClinic.com. That's www.KistnerVeinClinic.com. And join us again next week for Healthy Veins, Healthy Legs on AM 690 KHNR.